Let me move my stuff for a second. Oh, the charger cable won't reach it. Unless, are you using the charger?
I was going to.
Yeah, let me see. 3602. If you move over, let me know. Alright, hold on a second. We got more of that.
Trigeminal nerve. Trigeminal nerve is cranial nerve number 5. And, you know, by convention we use Roman numerals, so it would be V. It has 3 branches, 3. That's where the tri part comes from, trigeminal, 3. And so shorthand, you will see V1, V2, V3 for those 3 parts. V1, V2, V3. It's the thickest cranial nerve. Vagus would be the longest. So however you determine large. It will sensory, look at their name. Okay, mesencephalic will be in the mesencephalon, which is the midbrain. It will stretch into the pons a little bit. The spinal trigeminal nucleus begins at about C5, and it will actually stretch up into the pons a little bit. So I'll go through the medulla also. Some of the texts that you might read might refer to it as medullary, but the most common use would be spinal trigeminal. And then the third one is the pontine, located in the pons. The pontine is also known as the chief sensory nucleus, the principal sensory nucleus, or the main sensory nucleus, M-A-I-N. Misspelled. Trigeminal nerve is responsible for the face, general, somatic, afferent of the face, from about your ear, mid-scalp, forward. The motor component is going to be chewing muscles, muscle mastication. Three divisions, ophthalmic, maxillary, and mandibular. Okay, the sensory root and the motor root will exit from the lateral part of the pons. Lateral part of the pons. There's going to be a ganglion located on the petrous part of the temporal bone. Do you remember petrous part, temporal bone from osteology? No? No? Okay, it was the part that looked like a little mountain range. It had the internal acoustic meatus there. Well, there's a little fossa on that petrous part of the temporal bone that the trigeminal ganglion sits in. Trigeminal ganglion will contain the primary sensory neurons for the trigeminal nerve. Primary sensory neurons. It's like a dorsal root ganglion, except in the skull. The neurons in the trigeminal ganglion will be pseudo-unipolar. The neurons in the trigeminal ganglion will be pseudo-unipolar. Okay, three branches. Ophthalmic will be sensory only. This is V1. It exits the cranium through the superior orbital fissure. Enters the orbit. Superior orbital fissure. Maxillary is V2. Maxillary will exit the cranium through the foramen rotundum. That means round foramen. It gets its name because it's round. Okay, maxillary is sensory only. Okay, ophthalmic sensory only, maxillary sensory only. The next one is mandibular. Mandibular is going to foramen ovale. What shape is that? Oval. Okay, mandibular will be V3. V3. Mandibular is going to be sensory and motor. Mandibular is the only one of the three that also carries motor fibers. Okay, ophthalmic, sensory only, maxillary, sensory only, mandibular, motor, and sensory. Exits through the foramen ovale. On this diagram, here's the pons. Trigeminal nerve exiting pons, lateral side. Here's your trigeminal ganglion. Trigeminal ganglion is also known as the semilunar ganglion, because it looks like a moon. Another term you might see for it is Gasserian, Gasserian. It was named after someone named Gasser. Gasser actually didn't do the work on it, his student did. And to honor his instructor, the student named the ganglion after him. So in case you ever discover something, you want to throw that out there. Okay. Now this branch, which one is this?
Maxillary.
Ophthalmic. V1. It will cover
Okay, you can get
upper
the
scale,
rest of that.
forehead, nose, maybe the sides of the eye. How about this one, next one?
Maxillary.
Maxillary. Covers sides of the nose, upper lip, cheek. The last one, mandibular. Now, this is only one nerve. They made it look like two because they want to show sensory on one, motor on the other. Okay, this is going to cover lower jaw. Now, I give you sort of this general idea of the face, but it's also going to innervate deeper structures like the sinuses, the linings of the sinuses. So, if you get sinus pain in your cheek, that would be carried by the maxillary division. Sinus headache, ophthalmic division. Okay, Neckel's cave is going to be connective tissue that creates a loop that the nerve will follow, go into. Let's see. Clivus, basilar venous plexus, do you know what that is? That lies on the clivus. It's just a grouping of veins that lie on the clivus. The ventral aspect of the pons and brainstem will be medial to Neckel's cave. And again, think about that nerve comes out on the lateral side. Out lateral, you're going to have part of the temporal bone. The nerve has both sensory and motor. The motor actually is going to come from the mandibular division. Fibers, as they enter the pons, will ascend and they will descend. The descending ones will go to what nucleus?
Oh,
If it descends, what nucleus does it probably go to? Century pond. You have pre-century nuclei.
let's see. Oh, no.
Mesocephalic, pontine, spinal.
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 Yeah, spinal. Ascending group,
The first one you said.
mesocephalic. Right, first one I said. Okay. Motor fibers are going to go to the motor nucleus, which was where? What part of the brainstem?
The medulla?
Begins with a P.
Pons.
Pons. Okay. Mesencephalic pons and spinal. They are actually very specific for function. Very specific for function. So all the proprioceptive stuff goes up to the mesencephalic nucleus. Pain, touch, temperature goes to the pontine nucleus. Sort of your deeper touch goes to spinal trigeminal nucleus, the spinal nucleus. Okay. This is a picture showing the location of the nuclei. These three are sensory. Sensory are more lateral than motor. Here's your three divisions of nerve. What was B1?
It began with an O.
Ophthalmic. Yeah, covers forehead, around the eye. B2,
Maxillary.
maxillary. B3,
The mandible, jaw.
mandibular. Right, jaw region. This is really the same picture, maybe a little more nicely drawn. Okay, here's the motor route, the thin red line. You can see it goes in with the mandibular division. Also pay attention to these openings. Ophthalmic division is running through the superior orbital fissure. Maxillary division through the foramen rotundum. Mandibular division, foramen ovale. Petrous part of the temporal bone. Petrous means rocky, looks like a little mountain. Okay, now this picture is showing you some of the branches, at least some of the major branches. So for the ophthalmic, you will have supraorbital nerve, we'll have supratrochlear nerve, see, here's our mandibular, infraorbital, and again, there are some other branches. We're not going to get into all the branches. Superior alveolar, you should probably know that. When you see alveolar, they're going to teeth. So we've got superior alveolar going to your upper teeth, inferior alveolar going to the lower teeth. The inferior alveolar is coming from mandibular. If it doesn't work, don't use it. Any questions on that set? Divisions of 5, the next one we're looking at, divisions of 5. Sorry, it's not in great order. Okay. Trigeminal ganglion. What kind of neurons does it have?
It has motor and sensory, or very few motor, but more sensory.
Trigeminal ganglion, sensory only.
Oh,
So okay, good try. What do those neurons look like? Are they multipolar, bipolar, pseudo-unipolar? Okay, if they're sensory, pseudo-unipolar. But, so we're saying that the sensory neurons are here. Primary sensory neurons. Where are the motor ones? The mandibular will carry the motor fibers, right? Where's the neurons? No. Motor nucleus, which is located in the pons. It's medial to the pontine sensory nucleus. Okay, so sensory neurons are in the ganglion. The motor neurons are in the motor nucleus, which is in the pons. Now we talked about 3 nuclei that were sensory. Mesencephalon, the midbrain, the pons, medulla. What are they doing? What's there? Okay, the question is, if the sensory neurons, if the primary sensory neurons are located in the trigeminal ganglion, you know, we were talking about 3 sensory nuclei. What are those 3 sensory nuclei doing? Motor nucleus had the motor neurons, where the sensory nuclei have sensory. Yeah, it's going to be the second link in the pathway. So we said primary neurons are in the trigeminal ganglion. Secondary neurons are going to be in those sensory nuclei. Okay. Now on this picture again, you can see the ophthalmic division, maxillary division, and mandibular division. They did try to color code this. I don't know how well you can see the colors, but blue, ophthalmic, that's the area it covers. Yellow or gold, it's the maxillary. This is the area it covers. And then mandibular, green, that is the area it will cover. So, first division, ophthalmic. It leaves the cranium cranium goes into the orbit through the superior orbital fissure. Cavernous sinus is right around the pituitary gland. So this branch follows the edge of that cavernous sinus in order to make its way to the superior orbital fissure. It's got three primary branches: frontal, nasociliary, lacrimal. Okay, and we actually did some sub branches of those. Nasociliary will be most medial. Okay, think nose. Okay, most medial. Frontal is in the middle. And then lacrimal is lateral. Right? The mnemonic for remembering the order is NFL. N, nasociliary, is medial. Frontal in the middle. Lacrimal out loud. I understand that it will be a little bit perspective, I think, is a little hard with this picture. Most lateral is lacrimal. It will go to the lacrimal gland. This nasociliary should be on the medial side. And you can see it's right next to like the medial rectus muscle. Nasociliary. And then the frontal actually runs between those two. The frontal is going to be the most superficial. If you're cutting through the orbital arch, part of bone that goes above the eyeball, if you chip away at that, the first thing you should see is going to be that frontal nerve. It will lie on the levator palpebrae superioris. Frontal nerve innervates forehead, scalp, frontal sinuses. I'm not going to go with ethmoid sinuses though. The frontal, you can see two major branches there. One goes a little bit medial, it's called the supratrochlear. It will go right above where the superior oblique muscle is. The other one is supraorbital. There's a little notch or hole above your orbit. Sometimes you can palpate it on yourself. About right here on me. Okay, running through that little foramen or notch will be your supraorbital nerve. Nasociliary, upper eyelid, cornea, dorsum of the nose, but it's got these little branches. You can see one of them here going medially. So you'll end up with two going medially. The more posterior one is called posterior ethmoid. The more anterior one is anterior ethmoid. Those are the ones that would innervate your ethmoid sinuses. Okay? Ethmoids in both names. Right? There's a continuation after the anterior ethmoid branches off. There's a little continuation called the intratrochlear. Okay, we have a supratrochlear. There's also an intratrochlear. Okay, lacrimal branch goes out to the lacrimal gland. This will have nothing to do with tears. Nothing to do with tears. This is just if you put your finger up there and it hurts, don't do that. Alright? Don't put your finger up there. Don't make it hurt. But if you were to, the reason you could feel the pain would be because of this lacrimal branch. Okay, second division, maxillary. That's the one that's sort of orangey. Exits the cranium through the foramen rotundum, that was round. Passes by the cavernous sinus also. It's going to be lateral to the cavernous sinus. A lot of branches. Okay, we can see some of those branches, some of those sub-branches. This actually tends to run deep, and one of the areas where it's got a lot of action going on is called the pterygoid fossa. Pterygoid fossa. Let's see, we've got a little branch here. We can see below the eye. This is infraorbital. There will be about 3 going through the zygomatic bone. They will be zygomatic nerves. The number is variable. You might have 1, you might have 3. The 3 would have different names. Don't worry about them now. We've got the superior alveolar going to the teeth. Covers the middle part of the face. So here are some of the branches. Superior alveolar, they get broken down into anterior, posterior, middle. Middle meningeal. When you see meningeal, think dura. Okay, this is going to come back and innervate the dura. Infraorbital, we pointed out, below the eye. Main house. Zygomatic. Again, that can be broken up into zygomatico-temporal, zygomatico-frontal, zygomatico-temporal. Oh, I did that one. Zygomatico-frontal. Temporal, frontal, orbital, zygomatico-orbital. Inferior palpebrae nerve goes to the lower lid. Superior labial, upper lip. Pharyngeal nerve, mucous linings of the pharynx. Greater and lesser palatine nerves, again, mucous layer of the palate. Nasopalatine, nose and palate. This one says zygomatico-facial, which would be one of the 3 branches of our zygomatic. And here are some of these branches and the little holes that we went through. I mentioned the pterygoid fossa. That would be in this area right here. So you can see all these little branches coming out in that fossa. Tend to be relatively deep. Do you remember the pterygoid plates? The sphenoid bone? Okay. It's going to, these structures will lie anterior to that, to those plates. Some of them actually travel within the bone through canals. Okay, so areas that this maxillary branch will innervate. Again, generally speaking, it's going to be temple, cheek, upper lip, teeth there. And we said this actually kind of goes deep into that pterygoid fossa. So some deeper structures. So lower eyelid, conjunctiva, that's the lining that goes around your eyelids and over the cornea. Skin of the cheek, deep maxillary sinuses. Nasal cavity, upper lip, superior part of the palate, we mentioned those, and the upper teeth. Okay, sensory information, skin, sinuses, mucous membranes. I feel like I'm missing something. Mandibular. Okay, mandibular will stimulate movement in the jaw muscles. Okay, so this is a little out of place. Okay. Maxillary will still do this. But this one in the middle should be with mandibular. Okay. Third division, mandibular. Exits the cranium through the foramen ovale. 4 major branches. Buccal or buccal. When we talk about the facial nerve, we will also talk about a buccal branch of the facial. So with those ones, you got to be specific. Make sure you know what nerve you're referring to. Buccal branch of facial, buccal nerve of mandibular, branch of trigeminal. Usually you can go buccal nerve, means trigeminal, buccal branch, facial, facial. Inferior alveolar, buccal, by the way, goes to the cheek, soft part of the cheek. Let's see, inferior alveolar, lower jaw, lower teeth. Auriculotemporal, auriculotemporal curves back up and goes right in front of the ear. And lingual, towards the top. They don't have all of these labeled. This looks like it would be buccal. This one looks like it would be superficial auricular or interior auricular. Back up. Check the name right for you. Auriculotemporal. Right there. Normally, though, you see that in front of the ear. Here's your inferior alveolar. This branch coming out through the little hole is mental. Lingual, that would be right there, going to the tongue. See this little branch joining it? That is from the facial nerve. So facial nerve will also contribute to that lingual nerve. Okay, so mandibular branch, sensory innervation, mucous membranes of the oral cavity, in front of the ear, maybe into the internal acoustic media anterior two-thirds of the tongue, we're not talking about taste, not taste. What we are talking about is the mucus lining. So when you burn the tip of your tongue, that's going to be mandibular division. Okay? If you tasted whatever it was that burned the tip of your tongue, that would be facial. Motor innervation. Muscle of mastication, that means chewing muscles. Those are going to be things, a couple of them are listed here, temporalis, lateral and medial pterygoid, masseter. Okay, those are muscles that help you chew. Other innervations, there's a little muscle in the ear called the tensor tympani. That muscle is going to attach to the tympanic membrane and control its movement in and out. It's meant to protect you from loud noises. Digastric muscle, at least part of it, underneath the jaw. There's also a muscle there called the mylohyoid that it goes to. Questions on this? They will be multiple choice like before, not multiple answers. So, you won't get like A and B, B and C. It'll just be A, B, C, D. The last one that we will do pathologies of fire. I did put another set of slides that are a little bit more detailed. If you want me to go over them, I can. But trigeminal neuralgia, basically this means pain. They can be broken up into two types. Classic trigeminal neuralgia, and then painful trigeminal neuropathy. I'm not quite sure what the difference of those two are. When I think of neuralgia, I'm thinking of pain. They do tend to be fairly specific for the branch that they're responsible for, like you might get pain in your forehead, maybe not so much on your cheek if what's affected is the ophthalmic nerve. Okay, if it is the cheek, then you might not get that forehead pain, but you would get the cheek pain, and that would be mandibular. Maxillary. So neuropathy So it looks like these ones, something happens to the nerve. Classic, to be honest, I'm not really quite sure of. I'm not going to ask you questions on these. But you should know them for when you get to neurodiagnosis. Some ways to test your trigeminal nerve. Corneal reflex. Okay, corneal reflex is if you stick a finger in your eye and the other person closes it. Jaw reflex, where you tap the jaw and you follow the movements of it. Okay, here, taking a little stick pin to see if the person can feel it or if there's any paralysis in here. Testing motor function, clenched jaw. See if there's any weakness between the two sides. Okay, this is your corneal reflex. Now with the corneal reflex, you actually have to touch the cornea. Okay, I know there's been, I think, some information that is the anticipation of touching the cornea. No, you actually have to touch the cornea. But you do have some people closing their eye because of anticipation. But that's not really going to be that corneal reflex. Okay, here's a jaw jerk, tapping on the jaw. Seeing what happens if he's closing his mouth during it. Okay. Neuralgia, chronic pain condition, affects the trigeminal nerve. Okay, neuralgia, think pain. Symptoms, pain in the area supplied by the trigeminal nerve, and it can be very specific to the branches. Usually affects one side of the face, because usually it's going to only be one nerve that's affected. Rarely affects both sides, but possible. Constant aching, burning feeling. Causes. There's a lot of causes. It can be traumatic injury. By traumatic injury, something hitting your face, breaking bones, cutting nerve. Viruses, various viruses can cause that. Tetanus, I'm not sure of. Usually herpes zoster is what they mention. But possible. Surgery. There's facial nerve, when we talked about that Thursday, branches of the facial nerve run through the parotid gland. Okay? Those branches of the facial nerve are motor. But they'll run through the parotid gland. Parotid gland is susceptible to tumors, usually benign. But most glandular tissues are because of blocking of ducts. But there's a surgical procedure where they have to remove I did put up this extra one. Let me just show it to you real briefly. It's got a lot of the same information that we already went over, just presented differently. So, trigeminal nerve, the largest, where it exits, 3 nuclei, the motor nuclei. Areas that they innervate, tries to color code it, branches. Zygomatic is in plural because it can be up to 3 of them. And just various branches. This would be the neural pathway. Pathway's drawn out. Motor stuff. Okay, if you have COA, it has this nice little summary diagram in it. One thing that's interesting about the trigeminal nerve, it is not parasympathetic itself, but it actually has parasympathetic ganglia attached to it. That's what this says too. It tells you the nerve, the parasympathetic ganglion, and the part of the trigeminal nerve they're associated with. Okay, so do you need me to go over that in more detail? Yes? All right, let's take a little break then. And we'll start up at about 2:10. We'll go over this last set.
Hello there.
Hello. I don't know how much time we'll have after this lesson actually. But once it is, do you want me to quiz you on this stuff?
I see no reason not to. Do you want to do you want to do the PowerPoint again, or do you want to go through the flashcards?
I I quiz you,
Oh boy.
I might just use the PowerPoint one so I know all the information
That's-
you at least need. Because some of the things I think are on the flashcards,
Yeah.
but I think I know everything that's needed on the PowerPoint.
Yes. Oh boy. And I think it's also one of those situations where I don't know it until I'm looking at it. Because I'm getting a lot of the deficiencies mixed up in my head.
The deficiencies can mess me up a little bit too. We'll see. It's not until I get an actual exam that I need to
Yeah.
so we're gonna be done with it now. I guess.
No, he's got the full 2 hours and he's going to use them. Or he's going to use most of them at least.
I don't think who said yes. Continue with the thing. I don't think
He did say yes.
somebody he said yeah, I want to keep going.
Andrea said yes. So he did. But he usually ends a little bit early because we're already through number 3 out of 4 PowerPoints. So it shouldn't be. He'll probably be done before the end of class.
So because I want to study a little more at least.
Yes. I'm just going over different notes and trying to like shorthand all the rest of it.
I can give you a quick quiz if you need just on the names.
Yeah, sure. Go ahead. Go on.
What is Minnequonin?
Menaquonin?
Yeah. Minnequonin or whatever. Or no, it's not.
That's-
yeah, no. Minnequonin.
I'm not sure what you're talking about because as far as I'm.
That's the active form of one.
Oh no! Oh, I definitely don't know that then.
Or like at least the name of it.
B2.
Should be vitamin K.
Oh dear me. Is that yeah, that's one that has like 2 names, isn't it? It's got the
Yeah, it's
PH name.
Yeah, phenylquonin and minnequonin, something like that.
No.
But minnequonin's the main one you gotta know, I think.
Yes, and that's Menadonin.
There's definitely a key.
Hold on a second, let me pull up the minerals.
We got off to a strong start.
Oh, yeah, we're having a great time over here. This is I'm in minerals, not vitamins. Wow, what a day this is. Where's vitamin K? Did I delete the page on vitamin K by accident? Is K water or fat soluble? It's fat soluble. Why does she have vitamin K before she has vitamin E? That is silly. Yeah, you're right. I absolutely spelled that wrong. Oopsie.
Shocker there.
Oh yeah, hush. I'm known for my bad spelling. You know what's even worse? Shut up. You know what is even worse? My mother's an English teacher. I say I speak it goodly for a reason.
Yeah, that's cool.
It's oh well.
I think I just got into reading super early to where I had like burned words in my brain.
Gotcha. No, I've definitely not burned. Words are spelling is optional as long as I get the message across.
Yeah, exactly. You probably get the message across better than I do.
It's my expanded vocabularistics that lets me do that in a succinctly fashion.
What is calciferol?
Calciferol, that is either that's not vitamin D, is it?
It is vitamin D.
That's vitamin D because calcium is
Retinol
calcium.
and
Retinoids
retinoids.
is vitamin B5.
No.
Ooh, is it one of the B's?
No.
Uh-oh. Then it's then it's vitamin C. I don't know then.
Vitamin A.
Vitamin A.
Retinoic acid.
That's the one that goes into the
RAR.
cones, yes.
Yeah. What is taco?
That is vitamin E.
Yes. And what is ascorbic acid?
That is vitamin C.
Yes. Sorry. And what is folic acid?
Folic acid is B9.
What is B12?
B12 is not biotin, it's oh dear. It's one of the ones that has a long name.
Kind of.
Calcium.
Yeah, calobimin, whatever it is.
Yes.
What is B2?
I don't know that one. Riboflavin.
Yes,
Riboflavin.
What is thiamine?
Thiamine is B1.
Yes. What is paradoxase?
That is B6.
Yes. What is B5?
B5. Oh, we just said that one, didn't we?
Not yet, no.
What's the first letter?
P.
Paradoxin.
No, it's paradoxin is 6.
Oh, okay. You said P?
B5.
Panoic acid.
Yeah, I think
Pantanoic acid.
pentanoic acid, I think like pentagon 5.
Gotcha.
sides.
That's a good way to remember
What
that.
is
I like that.
Biotin.
Biotin is B7.
Yes. I think that's all of them.
That is. Okay, I'll have to put down the other name for vitamin K
Oh,
because I have not
B3
been doing
was
that.
B3.
B3.
3Ds.
3D niacin.
Yes.
I'm going to have to work on my acronym for
The
that.
active form of thiamine.
Active form of thiamine is thiamine phosphate, something like that. Pyrophosphate.
What is the active form of niacin?
125, something really long.
No.
That's not it. I don't remember. I know that was wrong, but I don't remember.
That vitamin D is that because vitamin D is calciferol,
Gotcha.
which is the 125 calciferol type thing.
Gotcha. I think he's back. We'll continue this in a second, though.
Okay, more trigeminal nerve. It's really, I think a lot of this will be reviewed, but maybe there's something you need more information on. So let me know. Why is it called trigeminal?
3.
3 branches. And what do we mean by when we say it's kinda the largest cranial nerve?
That depends on how you define large.
Yeah. Yeah, depends on the largest, the thickest. Right. What's the longest?
Vegas. I said about her.
Okay. It will exit the brainstem from the pons, from the lateral side of the pons. There are 2 roots, sensory root and a motor root. Which one's bigger?
Sentry.
Sensory's bigger. Which one's more medial?
Motor.
Motor. Motor's more medial. 4 cranial nerve nuclei. 3 of them will be sensory. 1 is motor. Where is the motor one? Those are fibers. Where's the nucleus? Motor nucleus. Where is the motor nucleus?
Bones.
Pons. In the pons. What does GSA mean? What's G? General. S. Somatic. Afferent. So general sensory of the face. Okay. So we say face, but it's like if you put a mask on. Okay, from the ears forward. Okay. So not only is it the face, but it's deeper structures like the mucous linings of sinuses, frontal, nasal, maxillary, ethmoidal, okay, oral and nasal mucosa, tympanic membrane, eye, conjunctiva, that's the lining that even the dura mater. It's a little branch that goes back to the dura. The anterior and cranial fossa. Trigeminal ganglion. What's in the trigeminal ganglion?
Sensory.
Sensory. Your primary sensory neurons, they are pseudo-unipolar. Pseudo-unipolar. Other names, semilunar, Gassarian. Okay, talked about the petrous part of the temporal bone. That is this area right here. The trigeminal ganglion will be located in a fossa on the anterior surface. Okay. Here's the actual nerve. Here's the ganglion. And then you can see the three branches. Ophthalmic, maxillary, mandibular. Ophthalmic, sensory only, maxillary, sensory only, mandibular, both sensory and motor. Little note on here says there's very little overlap. They are pretty specific for what they innervate. When you look at dermatomes in general, when you look at dermatomes, from the spinal cord, nerves that come out when you're looking at dermatomes, segments overlap about 50%. So C3 covers part of C4 and C2. Right? Now you get less overlap in about the chest region where you've got C4 meeting up with T1. Now, they're not very close together, so very little overlap. Here, you also get very little overlap. There's always some overlap, but very little. You're not getting 50% overlap like you would in your typical dermatomal segments. So, pretty specific for what they innervate. Okay, now I tried to color code, so I did green for ophthalmic. You can see green nerve. Ophthalmic does not supply a pharyngeal arch derivative. Okay, do you know what pharyngeal arches are? Have we talked about that, mentioned that? I think we have, but maybe you don't recall. Pharyngeal arches or bronchial arches. If you go with bronchial arches, that's going to be where gills form. Pharyngeal arches in the embryo become the pharyngeal region. It tends to be neck, face. Okay? When we talk about those functional components, if they were special, that meant they were derived from pharyngeal arches. Okay, so this one branch, the ophthalmic branch, does not supply a pharyngeal arch derivative, which means the other ones do. Enters the orbit through the superior orbital fissure. Runs through, at least a part of it, runs through the ciliary ganglion. I said at the end of the last one, and actually it was from this slide set, that the three nerves of the trigeminal look like they attach to parasympathetic ganglia. Okay. In this case, it's going to be the ciliary ganglia. Okay. It's not going to synapse there. You just have fibers passing through it. So it looks like the ciliary ganglion just hangs off of it. the eyes, conjunctiva, lacrimal gland. Again, it does not cause that gland to secrete. It goes there though. Other orbital contents, basically anything in the orbit. Nasal cavity, frontal ethmoidal sinuses, upper eyelid, dorsum of the nose, I think that's the top part of the nose, not the sides, it's the top. Anterior part of the scalp. One way you can test it is the corneal reflex, okay? With reflexes, you've got two parts, a sensory part and a motor part. The sensory part will be carried for the corneal reflex. The sensory part is carried by the ophthalmic nerve. Okay, it will respond to my touching the cornea. Okay, that's the sensory part. The motor part will be facial, but we're not talking about facial right now. The major branches, yep. Mnemonic is NFL. That's from medial to lateral. Nasociliary is most medial. Lacrimal is most lateral. Frontal in between. Nasociliary runs along the upper part of the medial rectus muscle. Okay, because it's medial, it's going to innervate medial stuff. So, outer part of the nose, anterior, superior nasal cavity, ethmoidal sinuses, medial part of the eyelid. Its major branches: anterior, posterior ethmoid, the long ciliary nerve, and intratrochlear nerve. Frontal. Of the three, the frontal is actually the biggest. Lies along the top of the levator palpebrae superioris. Again, if you're dissecting it down, going through the top of the orbit, that's the first thing you see. Because it's in the middle, it's going to innervate middle stuff. So frontal sinuses, forehead, scalp. Major branches are supraorbital. Okay, that was one I palpated earlier. And then the other branch is supratrochlear, which actually ends up going medially. Helps out the nasociliary a little bit. Like up higher. Lacrimal, lateral side, so it innervates lateral stuff. It will run along the top of the lateral rectus muscle. Does it innervate it? No. Just runs along the top of it. It goes to the lacrimal gland. And it's going to innervate stuff that are on that lateral side. Maxillary nerve, I colored this one gold because on the picture it was gold. That can be tough to see though. I mentioned earlier about the pterygopalatine fossa. I think I was just calling it pterygoid fossa, not pterygopalatine fossa. So, maxillary nerve exits the cranium through the foramen rotunda and gets into that anterior and middle cranial fossa, so up front, side there. Nasopharynx, palate, nasal cavity, teeth of the upper jaw, maxillary sinuses, skin covering the side of the nose, lower eyelid, cheek, upper lip. And again, it looks like there's a ganglion that attaches to it, the pterygopalatine ganglion. Okay, we don't see the ganglion here. Here's our maxillary division. It seems, I mean, they're all going to start off deep, but, you know, for whatever reason, to me, it seems this maxillary is a little bit deeper than the rest. It does come out superficial because it's got innervated skin. That pterygopalatine fossa is sort of back, way back in there. A lot of branches. Infraorbital. Infraorbital comes out from the infraorbital foramen. Up there. There are little branches that will go down to the teeth. Those are alveolar branches. Okay, superior alveolar. Pterygopalatine. Don't think we'll see on the picture, but it's described where it's going. Zygomatics, we break it up into three. They will all be coming out of this zygomatic bone though. So this is zygomatical frontal. Zygomatical temporal is going to be zygomatic bone but up in the temple. And then the third one is zygomatical orbital. So again, zygomatic bone, but you want to look at the orbit for it. Now you might have all three of those, you might only have one, which it'll still cover the same area, whether you have all three or one. Meningeal refers to branches going to the dura. Greater and lesser palatines. The greater palatine is relatively big, the lesser palatines are small, and they are variable. When I say something is variable, I mean that there are, depending on who you're looking at, there could be different numbers of them. The number is variable, 1 to 3. Lateral nasal, lateral side of the nose. Nasopalatine covers the nose and palate, deep though, sort of the mucosal linings. Pharyngeal, mucosal linings of the pharynx. Pharynx is the part that goes from nose to throat, nose to throat. Questions on that? Okay, blue, mandibular, again, color code, and another light blue. It's a little difficult to see. This is going to exit the cranium through the foramen ovale, the oval foramen. It carries motor fibers. The motor fibers will innervate muscle mastication, the tensor tympani. Couple more muscles than we mentioned before. Tensor palatini, that's a little muscle that goes to the palate and lifts it when you swallow. Anterior belly of the digastric, underneath the chin, and the mylohyoid, also underneath the chin. Sentry branches, skin of the lower face, sort of my beard line. See, mucus of the cheek, lower lip, ear, maybe a little bit into the external acoustic meatus. Anterior 2/3 of the tongue, again, not taste, just pain and temperature. teeth of the lower jaw, mastoid air cells. Mastoid process, do you remember where that's at? Okay. Back behind your ears. Looks like a knuckle coming down off the skull. If you cut into that, there's a lot of little holes there. Those are your mastoid air cells. When you have space, they get lined with a mucosal lining. So we have space here, so there's mucous membrane there, and it will be innervated by mucous membranes of the cheek, the mandible, dura, and the middle cranial fossa. There are also a lot of branches here. Here's some of them. Nerve to the medial pterygoid. Where does that go? Goes to the medial pterygoid muscle. Nerve to the tensor tympani. Where does it go? So, if you look at the name, it gives you information. Tells you where it goes. Meningeal, where's that going? Meninge, which is dura. Okay, mandibular nerve will have sort of an anterior division and a posterior division. The ones listed here are mostly motor, and again, they're named for where they go. Nerve to the masseter. Deep temporal is going to go to the temporalis muscle. Nerve to the lateral pterygoid. The buccal, nerve to the buccal muscle. The buccinator. Okay, we've got a couple sensory here. Auriculotemporal, that becomes superficial, innervates the skin right in front of the ear. Lingual, well, lingual means tongue, so that's going to innervate mucosal lining of the tongue. These inferior alveolar, you've got branches going to the teeth, but you also have branches going to these two muscles. Well, actually, one muscle, mylohyoid, this muscle. Mental will be sensory to the chin. So on this one, we've got mostly sensory except for mylohyoid. Trigeminal nuclei. 3 of them are sensory, 1 will be motor. The motor is going to be located in the pons. Trying to see where they put it, but they got a little high up here. Okay. So that's your motor on this picture. They've got motor on one side, sensory on the other. Keep in mind everything is bilateral. If it's on one side, it is also on the other. Our sensory, got mesencephalic, got the pontine principle, and you've got the spinal trigeminal. Goes down to about C5-ish. Okay. On our previous slides, they added a little bit more function than I have here. Mesencephalic, though, primarily, that's going to receive proprioceptive information, particularly from the muscles of mastication, from the muscles that are innervated by that motor branch of the trigeminal. Pontine, chief, principal, main, responds to touch and pressure, receives touch and pressure information. Spinal, pain and temperature. And we said on our other set, maybe some crude touch of pain and temperature. There gets to be a little bit of overlap between the pontine and spinal, unfortunately. body on it. Okay, with our sensory systems, we can actually map the body along the pathways. So, for head and neck, we can also do that. This is upper spinal cord, red is lower jaw, lower face, blue, scalp. So we have these three separate nerves carrying information from three separate places on our head and neck, on our face. Right? Well, that separation occurs throughout the entire pathway. So again, when there's a problem in one area, we pretty much know where to look to see where we can find where the actual issue is. So, the representation as it ascends up is upside down head. We have spinal cord, we're getting into the medulla here, but notice got lower jaw, middle face, upper face, and that arrangement stays, and it will continue up that way. The ascending pathways, most of the fibers are going to cross over. Most of the fibers are going to cross over. And they will cross over at different spots depending on where the nuclei are. They will ascend up. And they'll ascend up next to ascending pathways for the rest of the body. They'll be a little bit more medial. So terms that we use, medial lemniscus, ascending up. You may see trigeminal lemniscus, to be more specific about the trigeminal stuff. Okay, STT is spinal and trigeminal tract. And again, for the trigeminal stuff, that ends up being a little bit more medial than the rest of the body stuff. They will ascend up and they will go to a nucleus of the thalamus called ventral posteromedial, VPM, medial. Head and neck stuff, medial. From there to the somatosensory cortex. The head and neck area of somatosensory cortex is right above lateral fissure. Right above lateral fissure, so about here, side of the head. Feet, top of the head. So again, you can map a body along it. Head and neck stuff though, it's going to be side of the head. Red and blue is lower, it's below the neck stuff. So you got lower body in blue, upper body in red. For head and neck, that's green. We have the fibers crossing over. Some of them stay ipsilateral, but most of them cross over. You send up, notice it's the most medial thing here. Goes up to the medial part of the thalamus. And we said head and neck stuff is above lateral fissure. Motor, mandibular nerve. special visceral efferent. That means, special means it's going to things that were derived from brachial arches. So innervates, muscles of mastication, those are your chewing muscles. Those are things like medial and lateral pterygoids, the temporalis, masseter, tensor tympani. This was a little muscle going to the inner ear. Tensor palatini, that goes to the palate. This is the palate when you swallow. Mylohyoid and the anterior belly of the digastric. They're beneath your chin. Okay. Motor nucleus. It's going to be more medial than the sensory nucleus. The fibers only run with mandibular division. Only run with mandibular division. Excuse me. Here's our summary page from the clinically oriented anatomy. Pay attention to nasal cavity. Notice they've separated it in half. Upper part is innervated by the ophthalmic nerve. The lower part is innervated by the maxillary nerve. I mentioned a ganglion earlier, pterygopalatine ganglion, located in the pterygopalatine fossa. That's right here. Okay, notice this is also going to innervate palate and maxillary nerve, upper palate. There are 4 cranial parasympathetic ganglia. 4 cranial parasympathetic ganglia. Each of these 4 look like they're attached to a branch of the trigeminal nerve. Okay, so they look like they're hitching a ride. I mentioned earlier about the ciliary ganglion. That's going to be attached to ophthalmic division. And what happens is the fibers just pass through. They're not synapsing, they're passing through. The ganglion is actually going to be, in this case, part of the oculomotor nerve. The pterygopalatine, the trigeminal fibers just pass on through. This is actually going to where we have our synapse that actually originates from facial. Submandibular, trigeminal, just passes on through. Facial nerve, the actual synapse to the ganglion. The last one is otic. Trigeminal just passes on through. Okay, synapse, glossopharyngeal. Now I try to make sort of a chart for that. Everything on the left side are branches. Everything on the left side are branches of trigeminal. Okay, long ciliary is coming off the ophthalmic division. Lingual and auriculotemporal, those are both branches off the mandibular division. Okay, so ciliary ganglion. It's the ganglion for oculomotor. Long ciliary fibers pass through. Greater petrosal, part of facial, okay, that's ganglion. Maxillary nerve fibers pass through it. Chordotympany, also facial, okay, submandibular ganglion, lingual nerve, pass on through. Lesser petrosal, otic, auriculotemporal, those fibers pass on through. And again, lingual and auriculotemporal are branches off the mandibular. Okay, so ophthalmic, maxillary, mandibular, mandibular. All right, questions? Okay, did that set help any? Yeah. Okay.
It was presented better in this version.